And then a couple of days later, or no, it would have been about probably 36 hours later, because I think, I spoke to her on the phone, and then it was like the next night / early morning, I think. Sorry, some of the times I just blurred into one because it was just a really stressful, anxious time. I started spotting, and when I say spotting, it was only when I went to the bathroom and when I wiped that old brown blood it was, and it was very faint, like it was very faint. There was hardly anything there, and it wasn't coming out of my underwear, or I didn't need to wear any pads or anything like that. But I still was a bit like, I was still worried about it, and I googled it, and of course people were saying, oh, that's fine, I had, that the whole way through my pregnancy, or I had my period the whole way through my pregnancy and everything's fine now, I've got a healthy, 1-year-old or whatever it was. And there were also people who told, had, some really tragic, stories. And I think that's my biggest lesson I've learned, is just not to Google, because, if you Google something, you can get answers to support your theory and to not support your theory, if you know what I mean, like to make you feel better and to make you feel worse. Anyway, so I was worried about it. So as soon as my obstetrician's office opened, I called her again, and I, told her what had happened. She just said, look, she said, I know it's really hard to wait, but she said, spotting is common during early pregnancy. People sometimes have it the whole way through. It doesn't mean anything. It sounds like it's old blood. So she said, let's just wait till your 8-week appointment. So, I still got told to wait. So that was the Friday, of that week. And we weren't seeing her till the following Tuesday. So we waited the whole long weekend. And honestly, the long weekend felt like it was a month long. It was so long. I felt so bad for April, because I just didn't feel like doing anything. I just was so anxious, stressed, and I felt really bad for April, because I just was sort of like constantly Googling things and just on edge the whole time. Couldn't relax, and I was so emotional. And I felt bad for April, but April was it's like she just knew something was wrong, and she would come and cuddle us and kiss us all the time. And she would comfort us all the time, and I think she just knew something was wrong. Sorry. And so that whole long weekend, Bill was trying to be really positive, and I think looking back on it, he said that he thinks he was a bit too confident, that, oh, everything's going to be fine, everyone normally has to wait till 8 weeks, for their first appointment, and it's just because, our ultrasound didn't go so well last week, it's just probably our dates are wrong, and all this sort of, thing, and he was being quite confident and positive. And he said, why are you being so negative? And he didn't mean it in a mean way, but I said, I'm not being negative, I'm trying to be realistic with myself, because I was being optimistic and positive, but I think part of it was being realistic, because I just had this feeling that something wasn't right, and I don't know, I just, you just have that sort of mother's instinct, and it's just that something wasn't right, this feeling, and deep down, and something was wrong, and I don't know, and I couldn't escape that until I 100% knew that everything was completely fine. I'd heard that from obstetrician, and we'd had a good scan and all that, and I had ultrasound pictures and all that. Then I would feel, okay, this is right, this is actually happening, and I definitely believed I was pregnant, but what I mean is, you know what I mean, like, I just had this feeling. Anyway, that whole long weekend was so hard. We tried hard. It was so hard. We tried really hard to stay positive and keep as busy as possible, essentially. Like, we took April to the park a few times, and we had a picnic, and went and run some errands, just tried to stay positive, because I think for me, the previous week, just being at home the whole week, at home with April, we're just at home, I think it was making it harder and seemed longer, and it was, just making all my emotions worse, my worrying worse, and everything. So I think being out and about definitely didn't take my mind off it, because I was still thinking about it all the time, but just sort of, kept you busy, and yeah, so, and you know, this whole time, the whole pregnancy, I was, you know, praying all the time, and just really praying and praying with Bill and praying with April, and just yeah. And then the Monday night, the night before my obstetrician appointment, the 8-week appointment, we lit a candle, and it's a candle that I bought sometime last year, and it's called Baby Love, and it smells like, you know, baby Johnson's baby powder type, just like smells like baby. And we lit that candle and prayed in front of that candle, and yeah, that was just I felt like that was the last thing that we could do to hope that that everything was gonna be alright. Sorry. And anyway, got to Tuesday, and luckily one of my sisters was able to watch April, because I just think taking April with us, it would have just been really hard to have her there for the appointment, but so I'm really grateful. We went to our obstetrician appointment, and she was running an hour and a half behind, so it was like more waiting. It just felt waiting the whole pregnancy. And we're waiting. We went into she called us and went into her office and everything, and she said, how are you guys? How are you holding up? I just said, I'm so worried, She said, look, let's scan you straight away and then we'll talk afterwards. She took us straight in to her room to do an ultrasound, and she did an external ultrasound, so on my tummy, and she was quite softly spoken, and she just said there is a gestational sac and there is a yolk sac, and it has grown. It had only grown a few millimetres, I think, but she said that the embryo isn't growing properly and it's not developing properly, and it was really hard hearing that. And she just said that there was no chance that it would have a heartbeat. And I said, would it ever have a heartbeat? And she said no. She said that it would keep growing, but it would be growing and developing very slowly. It wouldn't have a heartbeat, and it would never be able to survive on the outside. So we were just in complete shock. I mean, even though I had this, I said I had this feeling about everything, nothing can prepare you still for what you're going to hear, and I think I still wasn't prepared, and I still was a complete mess, and I was still so upset, and Bill was just in shock, absolute shock, and she just said that this is an abnormal pregnancy, and I just was silent. I just was looking at her, and I couldn't say anything. I just started crying, and I was so upset I just couldn't say anything. And she said, go to the bathroom and empty your bladder, and then come back in and we'll talk. And so, went to the bathroom and came back, and she just said, this is an abnormal pregnancy. And, I just, in my head, I was thinking, what is an abnormal pregnancy, And she said, an abnormal pregnancy is where something happens when you conceive, and it's something, either whether it's the chromosomes don't match up and form properly, it doesn't implant properly, which wasn't the case for me. It had implanted properly, or it just wasn't, meant to be. And I just said, but what does that mean? I said, why? I said, why does this happen, and how does it happen? Is it something that we've done? And she just said, it's just Mother Nature. And she said 1 in 3 pregnancies are abnormal. And I just think that was really the hardest thing, is because I just wanted to know why, and why and how it happened, and you still ask yourself, why us? And even though you wouldn't wish it upon anyone, you still ask, why us? And she just, like, there were no answers. It's just up to Mother Nature, and it just is really hard to comprehend and really hard to process. She said that she doesn't call it, or she said we, and I think it means here, I'm not sure if it means here in Perth or here in Australia, but they don't call it a miscarriage because the baby as such wouldn't ever have a heartbeat, so it wouldn't be able to be a living, breathing baby at the end of the pregnancy. So a miscarriage would be if that was the case, and then you unfortunately lost the baby. But for me, it wouldn't have a heartbeat. It would keep growing, but it wouldn't have a heartbeat or anything. So it was called an abnormal pregnancy. And I just was like, it's just so confusing. And at the time, I just remember taking all the information to my head, and I couldn't say anything or think anything. I just didn't know what to think or what to say. And Bill was just in shock too. And I sort of said, so what happens now? Because I had been really scared. Over the long weekend, I had been Googling, what if something does go wrong, and what I guess would happen after that. And I was really scared to be honest, about having a D&C. Operation, surgery, anything like that, I'm just not good. I just can't even imagine, and I haven't ever experienced it before, obviously, except for giving birth. I just couldn't imagine doing it. So the thought of it just was scary. So I just wanted to know what was going to happen. And she just said, well, I think a D&C is a bit extreme for this situation. She said, I think that the best thing for you to do, because of your age and everything, is to miscarry naturally. So even though it's called an abnormal pregnancy, technically I still would miscarry it as such. And I said, so what does that mean? She said, well, what will happen is, at the moment, your body hasn't sort of caught on to the fact that it's not a viable pregnancy and it's not a normal pregnancy. So what will happen is your body will realise and will start to reject it and then expel it naturally. And I was just thinking, oh my gosh, like, I wasn't really sure if that was better compared to a D&C. I wasn't sure, but she said, I just think the best way for your body to pass this and get through this is naturally. It's the best thing for your body, and the best thing for your body to bounce back quicker, so that if you were to try again sooner, is naturally. So we decided to that we would wait and see if I miscarried naturally. And she said if I hadn't miscarried naturally, within 10 days, then she had a medicine, some pessaries, that I would obviously insert, and that would sort of bring on a mini labour, and then I would go on to expel it. And I just couldn't believe what I was hearing, because I just was thinking, like, so now I have to wait around for the inevitable, I guess, and meantime, going through all this, I still had all my pregnancy symptoms, and that's the thing, none of my symptoms had diminished or anything, so I wasn't worried in that sense. I still felt so pregnant. I had all the symptoms I'd had from the beginning, and I think that was the hardest thing, was your body is telling you you're pregnant, but your mind and your brain knows that, well, you're not, you are, but it's not going to be anything or come anything, or you're not going to stay pregnant, and you're not going to end up with a baby at the end or anything like that. And it was really confusing, very confusing. And Bill found it really hard as well, because I would talk to him about it, and it just was very, very hard to get our heads around, so she said that if I hadn't miscarried naturally within 10 days, to call the clinic and to come in and pick up these pessaries, this medicine. So I didn't really want to do the pessaries either, so in a way I was sort of thinking, I wanted to miscarry naturally, and but yeah, I don't think any of the options would have been obviously, the best option. Of course, you don't want to do any of those options, but anyway. And she said that, I said, how does this happen? And she said it's 1 in 3, and I'd never heard of an abnormal pregnancy before. 1 in 3, and that's a reason why I wanted to make this video, is because I googled abnormal pregnancy and I searched on YouTube and nothing came up, so I just thought, well, if someone else is going through what is called an abnormal pregnancy, type of miscarriage, that maybe hearing my story in my video would help them in some way. She said, and I asked her what the chances of it happening again are, and she said that the chances were remote of it happening again. And at the time, it wasn't really a comfort or anything like that. It just was a question I just had to ask. We both wanted to know what the chances of it happening again. I think mainly because we'd been through the chemical pregnancy, that we sort of were worried, And we did say that to her. We said, we'd had a chemical pregnancy and now this, and we're worried, and she just said that next time we fall pregnant, and especially because that doctor at the early ultrasound was so dry and quite blunt and rude and didn't show any emotional sympathy or empathy towards us or anything like that, she said that she would scan us early on, like we did with April, straight away as soon as she found out we're pregnant. So anyway, so she said that she wanted me to have one normal period, and then after that, so go through the miscarriage, have one normal period after that, and then if we wanted to try, if we were ready to try, we could from then on. So we just decided, when the right time is for us, we will. And yeah, sorry, everything is sort of in a blur, just thinking back to it all. So we left the appointment both really upset. Like, I was just obviously really crying, and obviously, they were in the waiting room, there were all these pregnant women, and it was really hard. And went to the car and just broke down crying, and Bill was so good, very supportive, and I'm just so lucky to have Bill, I'm so grateful to have Bill, and just really, really upset, and I just couldn't stop thinking about everything. I just was just like, thinking in my head, I'm still pregnant. At that point, I was still pregnant, and just being told that it's not going to go anywhere, like it's going to stop and finish and end any day. It was just a really weird feeling, and it wasn't a very nice feeling whatsoever. And so we knew we had to go back to pick up April, and she was my younger sister. So we did tell my younger sister everything that had been going on, because we hadn't even told her that I was pregnant yet, because we wanted to wait until we'd had our first scan to tell our siblings, and then after 12 weeks we would have told the rest of our family and friends, and told her everything. And she was really upset for us, and she's studying medicine at the moment, so she has done quite a few units on pregnancy and everything, and yeah, after that we came back home, and from then on, it's just the last few weeks since it happened, I've just been really up and down. Sometimes I can be happy and smiling and be brave, and no one would ever know that anything was going on. Then other days I'm just really down and upset and distressed about things, and just worrying about everything. And it's hard because we have a lot of Bill's friends who have recently gotten married or are in the process of getting married, are pregnant, or about to start trying, and so they all want to talk about it with me all the time, and that's it's great. I love talking about babies, and I love talking about pregnancy with people, and especially because I was the first out of everyone we knew to fall pregnant. you know, it's really nice that people come to me for, you know, advice and want to talk to you about everything, and I love it, but it's just deep down inside it was really hard, because I knew, you know, obviously Bill and I knew that everything that was going on, but we couldn't share it with anyone because it just wasn't right to share it, you know, until we knew what was going on ourselves. It was just, I don't know, we shared it, you know, with our parents and everything, and our siblings knew, you know, after um, so, you know, we had people asking us all the time, you know, when are you going? We have, and we had people asking us all the time, you know, what about baby number 2? When are you going to start trying for baby number 2? When do you want another baby? Anything, you know, I had people directly ask me a week before, on the long weekend, where we were waiting to find out what, you know, was happening. I had a couple of Bill's aunties directly ask me, are you pregnant? And it just was really hard. It was very hard, and it is very hard when people ask you, because, you know, technically I was pregnant at that time, but everything was still, you know, up in the air, and we didn't know what was going on, and we didn't have any answers. And still, we've only decided to share everything with our immediate family, so just our parents and siblings. We're not going to tell our grandparents or, you know, cousins, or, you know, anything like that. I mean, I have told a couple of close girlfriends, and Bill's told a couple of his close mates. Just mainly for me, I found it, you know, a lot easier to accept everything once I started talking about it, because I was finding it really hard to process it all, and I know Bill was too. And I felt really bad for Bill, because I felt like he did have to go back to work, and I had more of an opportunity to talk to people. You know, I had the time to talk to people about everything, and that, to me, talking about it, and even talking about it now, it just really helps to process it, you know, because it was so confusing, and it still is very confusing. It's hard, you know, people are still asking, you know, about baby number 2, and believe me, without a doubt, we want baby number 2, and whenever it happens, it will happen. I know it will happen when it's meant to, but it just is really hard, you know, when people ask, and I know that they don't know, and they don't mean anything by it, but it's just, yeah, it's hard.